Okay, Geiger. I haven't seen you in a while. What you been doing with your body, man? Your cholesterol's off the charts up to 269. Your LDL or bad cholesterol is 188. You know that really puts you at risk for heart disease. It's going to clog your arteries up, just like that little diagram over there on the door. Okay? So these are things that you need to do. One, you need to get a lot tighter with your diet. Avoid fats, and especially saturated fats. Cut the skin off the chicken, cut the visible fat off the meat, go more towards a vegetarian type diet. You also want to increase your aerobic activity. So running 2-3 times a week, at least 30 minutes is not a bad idea. Your HDL cholesterol actually is pretty good at 62, but that still doesn't counterbalance off the bad one, the LDL. So I think if you're able to implement some of these changes, you should probably check your numbers again in about 3 to 6 months and see if your lifestyle modifications have really made any kind of difference in what you're doing. Otherwise, you're looking at medications. Now, medications, they're well tolerated, but it is a pill that you got to take. There are side effects. There's costs involved. There's monitoring. So you need to make some choices for yourself as far as whether you want to do this in a more natural lifestyle modification format, or you want to do drugs, or you may have to do medications because not all cholesterol is from your diet.
Okay.
Some of us have just a problem with our livers making too much cholesterol. And the only way we can differentiate that is for the patient to do the lifestyle modifications aggressively, because when I measure cholesterol on you in the lab, what you make and what you eat looks exactly the same.
Sure.
So let's work on the diet and your exercise. Let's see you back in about 6 months. We'll kind of take it from there.
As I think about going to this vegetarian, vegan style lifestyle, what would you recommend?
I think, you're a smart guy. I want you to go do some homework, do some checks on the internet. You can one reputable website is Medscape. You can go out there, take a look at what they have to say. I'll go ahead and give you some handouts in the office today as far as things that you can do and what some of the drugs are, because like I said, the drugs are safe. I use them on a lot of patients, but philosophically, do you want to be on a drug?
And that's where I'm at.
Or not. And if philosophically you don't want to be on a drug and you're able to do something that keeps under control, then that is your treatment. Okay. I think most people or patients think of treatment as give me a pill.
Right.
Well, so it's nice and refreshing that patients actually want to come in and do something proactive for themselves first. But I've kind of found over time that we want to do that for a limited time period to try and stay above any long-term complications of your cholesterol being high. Because I've seen in my own practice, we keep having this discussion, and all of a sudden it's 5 years later and we're having exactly the same discussion. So we're going to do short-term follow-up, 3 to 6 months. 3 months if you'd like, or we can do it at 6. But at that point, if it hasn't changed dramatically, I think we should be looking probably at medications.
Fair enough.
Now, typically, everybody hears about the LDL cholesterol being under 100. If you're going to do that, you better put a statin in the water supply, because it ain't going to happen.
Okay.
For you, without other risk factors, getting your LDL around 130, I'm comfortable with that. So we're looking at about a
50-point drop.
Mm-hmm.
Okay.
And I'll give you copies of your labs today.
Yeah.
So you can
and I'm getting back to working out because I don't know if they sent you the report, but I had a slap tear in my left. And so that took me out of the martial arts.
Okay.
So I was kind of just feathered that out until I finished my rehab on that. It's fine. He suggests surgery if I want to stay aggressive in the martial arts. I'm opting out of being aggressive in the martial arts because then it's 6 months of not doing anything anyhow.
Well, I think if you just do aerobic stuff.
Right.
Get your heart rate up, running, biking. You can bike. That's not going to do any damage to your shoulder. Probably an elliptical's okay, but I defer to the orthopedic guy to see if he thinks that's okay.
Okay, great.
All right?
Thank you, sir.
Anytime.